We actually did clinical studies. So this clinically studied program through the Hughes Research Center, right here, what we did is we took hundreds of people that have metabolic syndrome. In other words, they weren't healthy. They had problems. They had clinical problems. Everything that we discussed, the belly fat, blood pressures, the triglycerides, and we asked them to eat differently and add a supplement program, which we're going to talk about today. And these are the ingredients. So if we're going to detox and use fibers, remember I talked about plants, fiber, and fermentation. We have some psyllium. We have something called glutamine. Glutamine is an amino acid that I always remember as glue. So it helps glue your intestines back together. Chicory inulin, one of the most powerful and highest studied fibers there is. Chicory inulin. Chlorophyll, which you're familiar with, zinc. And then we bring in something called nitric oxide. Anything that's called a nitric oxide generator is going to help the body with circulation. So why these first two things? Well, if we can increase circulation with nitric oxide, and here we use red beets, arginine, a little more glutamine, a little more chicory, what happens is the circulation starts to increase and the body says, okay, I've got a faster river running now. It's more open, it's more regulatory. The detox in the fiber comes along and says to the body, and here's a way that if you dump your poisons, I can bind them for you. And then of course we add a little probiotics because we want to keep the digestive system very healthy and regulated in a positive way, because sometimes we get bad critters. There's something called dysbiosis. And then protein shakes to help feed those probiotics. So this is what we did. We did 2 servings a day of the detox fiber. We did 2 servings a day of nitric oxide dual pathway generator. Did a couple capsules of a probiotic, and we did 2 servings of protein shakes. And then we let them have a regular meal, usually with plants, right? You know, lean protein, good fats. And that's what we did. We said, here, just stay on this. And we asked them to do it for 90 days. And the interesting thing, and the science blew everybody away, because when we started doing that, it was working as fast as 1 week. I've been in natural health for a long time, and I always put people on 3-month, 90-day programs because I say it takes that long to change anything. Well, when I saw these results, that's why I got jazzed. I got really excited. I was like, oh, wow, I'm in. I want to teach this. I want to go all over the world and tell everybody about this revolutionary idea that we have. So some of these statistics, if you just quickly look at them, 9% decrease in oxidative stress, or GGT. Well, what that means is the liver is functioning better. A 13% increase in metallothionein. What is that? It's a big word to say we can measure heavy metals coming out of your fecal matter. A 13% increase in getting out heavy metals in 1 week. That's unheard of. I don't know medications that can do that. Chelation, all those sorts of things. This is a very significant number. We saw toxic metals being increased in the urine. We saw our fatty liver index coming down, because fatty liver is everywhere. It's the fastest growing problem in diagnostic and medicine. 34% drop in insulin levels, which means the blood sugars were responding. And then the blood pressure started to drop. So remember when I started out by saying, you know, I started in medicine, they had no idea where high blood pressure came from. All of a sudden we're seeing something from a natural perspective drop that. Decrease in 10-year cardiovascular risk, energy, lower fatigue, mental health, weight loss, total fat mass, and this all in 1 week. Yeah, these numbers aren't, you know, massive, but you got to understand, all of those numbers just in 1 week, you're going to feel that. That's incredible, and your labs start to reflect that. But as we went on and we measured these people, look what happened in a month. We started seeing something called fecal zonulin, which really helps us understand that the gut is healing and it's becoming solid again, because zonulin markers tell us whether the gut is leaky or not. Something called calprotectin. Basically, the intestines stop being inflamed, these itises, the liver, the excretion, fatty liver, the insulin, the blood pressures again. All of these things just start amping up the longer you do it. Imagine what would happen if you did this for 3 months or 3 years What if you did it for life? So this is really a lifestyle program, a lifestyle program. What this big study here is telling us that what we looked at through the Hughes Research Center in our clinical studies, as we said, we're going to look at not only other competitors, but we're going to look at ourselves, right? We're going to look at everything. So what you're seeing here is just looking at what everybody else is offering out there, weight loss, and just looking at the various programs. You know what those all are. I don't have to mention them. But down on the left over here, you can kind of see these are all the studies, and there's a few of them that are mentioned. So anyway, yeah, just doing a healthy, what's called NATR meal is outpacing what everybody else is doing. Well, what is that meal? It's plants, fiber, and fermentation. That's all it is. It's just plants, fiber, and fermentation. When we say fermentation, you know, like kimchi and sauerkraut and green tea and apple cider vinegar, those types of things. And then we add the supplements you see at the very top, NATR programs. I mean, that's just blowing away any competition out there. There's nobody that can touch what we're doing right now.